Hello, everyone. Welcome back to another episode with Wellness Pearls. It's your host, Stacy, and I am back with another exciting topic that we're going to talk about today that is going to be more and more prevalent, and it's not in a good way. And we're talking about hypertension. So, according to the CDC, almost half of the U.S. adults as of 2021 have high blood pressure. And also, 1 in 4 adults only have their blood pressure under control. Only 1 in 4 adults have it under control. Now, these are statistics that were taken back in 2021, so I'm sure the numbers look worse as of now. According to the World Health Organization, approximately 1.28 billion, that's with a B, billion people have high blood pressure. And this ranges anywhere between the age of 30 to 79. The sad part is less than half of those adults are treated and diagnosed properly. Hypertension is becoming increasingly popular among not only adults, but also younger adults as well. We're going to dive into what is high blood pressure, the contributing factors, diagnosis, as well as treatment and prevention options in today's episode. So let's dive right in. What is hypertension? So hypertension is basically another term for high blood pressure. You might hear these terms being used interchangeably in the medical field, so don't get intimidated. It just means high blood pressure. Hypertension or high blood pressure is a condition in which the force of the blood pushing against the arteries is high. And in turn, your heart has to work harder to push that blood. High blood pressure is measured in millimeters of mercury. According to the American College of Cardiology and the American Heart Association, normal blood pressure is noted to be 120/80 or less. Stage 1 hypertension is noted to be between 130 to 139/80 to 89. And stage 2 hypertension is noted to be above 140/90. The problem with this is that untreated high blood pressure can lead to various fatal problems, such as heart attacks, strokes, various other medical problems. So, which is why it is crucial to not only get diagnosed, but also get treatment for high blood pressure. So, who is at risk for high blood pressure? Of course, everybody is at risk for high blood pressure, but there are certain groups that are at a little bit of a higher risk compared to others. And these groups include those, for example, over age 65, because as you age, the risk of high blood pressure increases. Of course, if you have a family history of high blood pressure, if you're overweight or obese, lack of exercise and just being sedentary, tobacco use or vaping, or if you have an increased sodium intake, alcohol use, stress, certain conditions like kidney disease or diabetes. You can also have high blood pressure during pregnancy, known as gestational hypertension. So there's various risk factors out there, but just know that anybody can get high blood pressure. What are the symptoms to watch out for? So the scary part of this disease is that usually there's no symptoms. And a lot of adults can walk around in normal daily life without knowing that they have high blood pressure. People can have high blood pressure for years and years and not know it until it becomes a bigger problem, until they come into the ER with a heart attack or a stroke or for some other medical condition and inadvertently find out that they have high blood pressure. And trust me, you do not want to be in that situation. When you're talking about symptoms, sometimes people can have symptoms like a headache, chest pain, dizziness, nausea, vomiting, blurry vision, any abnormal heart rhythms, but many and a lot more symptoms. But a lot of these symptoms are not truly specific to just high blood pressure. That's very important to know. That just because you're having a symptom does not equal high blood pressure. The only way to truly know if you have high blood pressure is to have a healthcare professional measure your blood pressure. And if it remains elevated on 2 separate occasions, you typically get diagnosed with high blood pressure. As far as the diagnosis goes, when you're looking at the blood pressure readings, they come in 2 different numbers. You've probably noticed that if you go get it checked, at a store or at a healthcare professional's office or even at your house, you see that it comes in 2 different numbers. So the top number is known as the systolic blood pressure, which is the pressure when the heart beats. The bottom number is the diastolic blood pressure, and that is the pressure in between the heartbeats. Now, if you're diagnosed with high blood pressure, your healthcare professional may order additional testing, like maybe a EKG or an echocardiogram or labs, to make sure that all the other conditions are okay and that your blood pressure is not being contributed by any other medical illness. You can also check your blood pressure at home by buying a blood pressure machine and checking your blood pressure. You can keep a log of it and take it with you to your PCP or your healthcare provider so that they can assess it at the office as well. They can look at the trend of your blood pressure at home, and they can also assess it at the office and then treat it accordingly. Important thing to know is that high blood pressure is not age specific. As in, just because you're young, you're not going to get it. No, get that out of your head. Because we are seeing hypertension being affected at any age, and we're seeing more cases in younger adults. So it's very important and crucial that you have your blood pressure assessed by a healthcare professional and get diagnosed early before it becomes too late. Now, what are the treatment options? So there's a lot of lifestyle changes that you can make in order to aid in lowering your blood pressure. These changes can include losing weight, increasing your physical activity, eating a heart-healthy diet, decreasing your sodium intake. If you're smoking, to stop smoking. If you're drinking a lot of alcohol, to limit the alcohol use, increasing your sleep, and making sure you're just getting an adequate amount of sleep and lowering your stress levels. Sometimes, and a lot of times, these lifestyle changes alone may not be enough to treat your blood pressure and to lower it back down. And there are various classes of medications that can be used to lower your blood pressure. And these classes of medications include ACE inhibitors and ARBs and calcium channel blockers, diuretics and beta blockers and vasodilators and many, many more. It might take a trial of a certain blood pressure medication or a combination of blood pressure medications in order to get your blood pressure down to an optimal level, which is why it is crucial, and I can't stress this enough, that you have close follow-up with your healthcare professional so that they can monitor you closely and titrate those medications accordingly. You don't want to be walking around and just go see your PCP one day, they give you your medications, and then you don't see them until the next year. And your blood pressure can fall dangerously low, or it can remain elevated and still remain elevated despite taking the blood pressure medication. So that's why it is important to follow up, and your healthcare professional will make sure that you follow up so that they can monitor your blood pressure and titrate medications accordingly so that you're at a safe level. Prevention-wise, are there any preventative therapies that you can do to avoid getting blood pressure? So there are certain lifestyle changes that you can do, and I listed them earlier, in order to help prevent or at least reduce your blood pressure. And that includes being more physically active. You want to try to incorporate about 150 minutes of moderate intensity exercise a week. Try to be less sedentary, less sitting, more moving around, reducing your weight if you are overweight or obese, eating more fruits and vegetables, and following a heart-healthy diet and a low-sodium diet. Reducing your stress levels, getting more sleep in, limiting alcohol, and stopping smoking or tobacco, whatever use you have going on, and limiting foods that are high in saturated and trans fat, and limiting your sodium intake to less than 2 grams per day. So this one is a biggie, because you would be surprised at the amount of sodium that is present essentially, you see it a lot high in processed foods, fast foods, frozen foods. So read those labels so that you don't fall off track. I have been surprised at the amount of sodium that's present in certain foods. Like if you order a fried chicken sandwich, for example, that itself would have close to 2 grams, just a sandwich. And it's astonishing the amount of sodium that an individual can intake in a day if you're not cautious and careful and mindful of what you eat. So read those labels so that you don't fall off track. Limit those foods. It's important now than ever to have your blood pressure checked and treated in order to avoid a deadly complication down the road. So if you have not had your physical yet, schedule that as soon as possible with your PCP, and so that they can do the proper workup and diagnose you correctly and treat you accordingly. Hypertension is a disease that should not be left untreated and should not be taken lightly. It's a disease that can easily be diagnosed and treated. So please don't wait to have it treated, or even worse, find out you have high blood pressure in an unfortunate situation. So that pretty much sums up this episode. I hope this has provided you with some insight, some knowledge regarding hypertension. And as always, please drop your suggestions and feedback. I truly appreciate them. You do know, if you haven't known, that Wellness Pearls is on Facebook, Instagram, TikTok, Spotify, and YouTube. So please follow and subscribe to those. And we also drop handy tips on those social media sources as well. So please follow and subscribe and share this with your family and friends so that they too can benefit from this knowledge. And you never know, you might save a person's life through this process. Thank you so much for tuning in, and I hope to see you all in the next episode. Ciao.